Millions of people do everything exactly by the book. They take 3, 4, or even 5 different blood pressure pills every morning, yet the numbers on the monitor stay dangerously high. We are going to map out why the body resists these medications, how to verify if resistance is real, and the biological malfunction at play. We will also explore the clinical evidence showing how a structured walking protocol can force those stubborn numbers down by 10 full points. This diagram breaks down the hierarchy of severe high blood pressure. When patients remain above target despite taking 3 different medications at maximum doses, doctors classify it as resistant hypertension. If it takes 5 or more drugs and the pressure is still uncontrolled, it becomes refractory hypertension. As you can see by the highlighted metric here, hitting this level of resistance carries a 47% higher risk of major cardiovascular events, like strokes and heart failure. Before looking at the biology of the disease, we have to rule out what doctors call pseudo-resistance. Oftentimes, the medication hasn't failed, the environment or the measurement routine has. Looking at this breakdown chart, we can see that roughly 38% of apparent resistant hypertension cases are actually misdiagnosed. The culprits are surprisingly common: a rushed nurse using a blood pressure cuff that is too small, clinic anxiety, often called the white coat effect, spiking the heart rate, or simply missed doses of medication at home. To get an accurate picture of what your cardiovascular system is doing, you need to request a 24-hour ambulatory monitor from your doctor. This tracks your numbers automatically throughout your normal daily routine. You also need to audit your pill routine with absolute honesty to ensure consistent dosing. Ruling out bad measurements and missed pills is the required first step. You have to verify that you are actually fighting a biological resistance before you start adding more chemicals to the mix. True resistance is driven by internal storms. Aldosterone commands the kidneys to hoard salt and water, expanding total blood volume and driving up pressure. In refractory cases, the sympathetic nervous system locks into fight or flight, forcing blood vessels to constrict and stiffen. The medical community's standard response is pharmacological. Doctors typically start with triple therapy: an ACE inhibitor, a calcium channel blocker, and a long-acting diuretic. If that fails, they introduce a fourth-line defense, typically a drug called spironolactone, designed to block the excess aldosterone. The problem is that for many patients, the chemical toolkit eventually reaches its limit. Adding a 5th or 6th class of drugs yields diminishing returns, failing to completely neutralize the salt retention or the nervous system overdrive. There is a physical ceiling to what pills can achieve on their own. When the pharmacy plateaus, the body requires a non-pharmacological intervention to break the deadlock and lower the pressure. That intervention is structured physical movement. Regular exercise reduces 24-hour ambulatory systolic pressure by an average of 10 points and diastolic pressure by 5 points. That drop is mathematically equal to adding another heavy-duty prescription drug to your regimen. Movement mechanically suppresses the hormone cascade, telling kidneys to retain salt, mimicking spironolactone. It also lowers plasma norepinephrine, successfully calming the sympathetic nervous system's fight-or-flight response. Finally, pumping blood triggers nitric oxide, the glowing particles here, forcing rigid vessel walls to physically widen out. Warm water walking in 90-degree pools acts as a thermal vasodilator. The hydrostatic pressure calms the nerves, while buoyancy protects your joints from impact. Brisk walking serves as a precision physiological therapy, systematically dismantling the chemical and neurological mechanisms that keep blood pressure high. The clinical data reveals a phenomenon called Wilder's principle. This line graph plots baseline blood pressure against the expected reduction from exercise. The trend line clearly dictates that the higher your starting numbers are, the more drastically physical movement will drop them. The patients with the most severe resistance stand to gain the most. The target prescription is 3 sessions a week of aerobic activity. That means briskly walking through your neighborhood or taking a warm water pool class, paired with light resistance training. A single exercise bout drops your pressure for up to 24 hours. But to force the blood vessels to permanently widen and remodel themselves, you must maintain strict consistency for 8 to 12 weeks. Here is your action plan. Step 1. Rule out false resistance. Get a standardized measurement in the clinic and ask your doctor for a 24-hour ambulatory monitor to track your true daily numbers. Step 2. Optimize your daily medication foundation. Review your prescriptions with your doctor and ensure your current regimen includes a long-acting diuretic, which is critical for resistant cases. Step 3. Commit to aerobic movement 3 times a week. Use the physical force of exercise to biologically suppress the hormones driving the resistance. Resistant hypertension is a formidable opponent, but when medications reach their limit, your own movement can cut through the resistance. The simple act of lacing up your shoes sends a biological command to your cardiovascular system to finally stand down.